Thank you for joining us today, Angelina. My name is Belinda Rumara, and I am the HIV prevention specialist at Brook, and I work on the HIV prevention service in Barnet. So on our service, we do professionals training, outreach, and digital engagement to raise awareness around HIV and prevention services in Barnet. Angelina Namiba is the founder member of 4M and has been working in the field of HIV for the last 26 years. Angelina, could you tell us more about yourself and the work you do, please?
Hi, Belinda. Thank you very much for having me. So a little bit about me. Personally, I'm originally from Kenya, but I came to the UK in 1989, many years ago, to join my late mom and to go to university in Manchester. So 6 months after my graduation, I was diagnosed with HIV. I was just in my mid-20s then. So that was nearly 29 years ago. Luckily, I managed to access peer support very early on in my diagnosis, and then I started volunteering and have been working in the HIV sector since then. So that's, as you mentioned, 26 years ago. I've had a period of ill health recently, and had to take a break from work, but I'm very grateful to still be here. So professionally, as you mentioned, I am a founder member of the Forum Network of Mentor Mothers Living with HIV. And I just want to share a little bit about Forum Net. So Forum Mentor Mothers Network CIC is a perinatal peer mentoring program working with women living with HIV, where Forum stands for my health, my choice, my child, my life. It is a perinatal peer mentoring project whereby we train and scale up mentor mothers living with HIV to provide support for their peers who are pregnant or planning to start families, but also beyond that, we train them around their own personal development. So we do this through a delivery of pregnancy journey workshops. We provide mentoring, support, capacity building, supervision of the mentor mothers, training, advocacy, and we also collaborate in partnership with service providers who work with women, pregnancy, mental health, sexual and reproductive health, and HIV, and other closely related issues. We are very committed to ensuring the meaningful involvement of women when we work with, as well as ensuring that they not only support their peers, but they build up their skills and capacity, and that they are involved throughout all aspects of our work. So we do our utmost best to amplify the voice and visibility of women living with HIV in forums where decisions about our health and care are made. So for more information about us and the work that we do, you can visit our website, which is a very simple one. It's 4mmm.org.
Amazing. That sounds like 4M is such a great organization, and I thank you for that. And I hope anyone that feels that they want to know more about 4M know where to go. So moving on, late diagnosis is a growing concern in the UK among women. As a HIV advocate and a woman living with HIV, what are the barriers that women may face in seeking treatment, or that may be getting tested or seeking treatment after they get a positive or reactive result?
Thanks, Belinda. I guess there are quite a number of barriers that exist, and again, I'll talk about some of them, but I think one of the main ones is probably the fact that testing is being in places that are not convenient for them. And they may also not be comfortable about accessing traditional sexual health clinic for all sorts of reasons, shame, judgment, someone they know might work there or see them. And I've actually seen quite innovative ways whereby I've seen an organization called Positivist sometimes do testing in my local library. So I think it's about making the testing services accessible to them away from the traditional places where they access healthcare. But one of the other reasons I think in terms of testing is probably many women don't test because they don't know that they're at risk. And with that same vein, many may not test because they do not perceive themselves to be at risk, for any number of reasons. The usual ones people use are, well, I'm in a monogamous relationship, or I trust my partner, etc. But you and I both know that actually those are not good reasons for not testing, because actually you can only know about your status, and you can only know about your status and whether you're positive or not, but you cannot guarantee the status of your partner or your husband. And I'm not saying that in a bad way, I'm just saying, actually the only way, you know what I mean? You cannot say that I trust my partner, or so many of them don't perceive, I'm an organized relationship, many of them don't perceive to themselves to be at risk. I think another reason, another barrier is, I guess, the migrant status and also just lack of knowledge about healthcare entitlements or not.
Yeah.
Some may not access healthcare or tests because of probably poor previous experience, stigma within the healthcare side. And I'm not saying it happens all the time, but they may have experienced stigma in other places. And they may also just other structural issues as well. So in terms of some personal reasons, if you look at poverty, some women may lack the resources to get to the clinics, or the clinic may be hard for them to reach. There are also issues around mental health. And of course, we know that, that can be a barrier to you accessing services, because obviously you're dealing with other stuff. There's issues around addiction. And I'm going to mention one more, although there are many more, but I think that there's also the issue around intimate partner violence and coercive coercion, because some women may be in relationships whereby they're emotionally and economically dependent on their partners. And also in that same vein, their partners may decide whether or not they can access not just healthcare services, but any other services whatsoever. So those are just some of the barriers that do exist for women, although I've not mentioned all of them.
How do you think we can address a few of the barriers? So maybe 3 of the barriers, how can we address them?
I think maybe I just take a general approach in terms. There's so many barriers, yeah, and a lot of them are to do with access information, not knowing the at risk, etc. I think for me, the way we can address these barriers is by providing and enabling women to have what I call the knowledge, the will, and the power to access services, be they testing services or treatment services or healthcare services or social care services. Yeah. So by the knowledge, I mean knowledge about information about what HIV is, what STIs are, how are they passed on, what is testing, why is it important, where do I need to go, and the fact that testing is available, it's free and it's accessible. That, don't be afraid to access healthcare services or tests, because healthcare professionals work under confidentiality rules and guidelines. So, your information will be confidential. So that's about having the knowledge. And in terms of the will, it's about them being able to act to protect themselves, having that will to want to reduce their risk of passing HIV on, for example, if they have HIV, having the will to want to access healthcare services to look after not only their own health and well-being, but also their, significant others, because many women don't just come by themselves. We're caregivers, we are partners, we are sisters, we're mothers. So having that will to be able to access healthcare services and well-being, and also having the will to understand the benefits versus the risks of accessing healthcare services. That's what I feel about the will. And also it's important that women have the power to access material resources, for example, for prevention. So for example, when I said that it's about, you can give people the information, the knowledge, and they can have the will to do it, but they need to be able to access, the resources need to be available for them. So to be able to access things like prevention, things around condoms, lubricants, access to HIV testing, and even the skills to be able to use those condoms or to negotiate safer sex, for instance. So they need the power. The power is also about the assertiveness and interpersonal skills. And also, as I mentioned, around intimate partner violence, the skills to be able to be free of physical force. Yeah. And last but not least, having a choice to actually access the services and the opportunity to do so.
Thank you for that, Angelina. Moving on from care, I wanted to speak a little bit more about PrEP. So PrEP is a drug you take, HIV negative people take before sexual intercourse when having condom-less sex, and it prevents HIV. PrEP is available free on the NHS to everyone, but how can people decide whether PrEP is for them?
That's an interesting question. And I think there really isn't a very straightforward answer, but that's mainly because that decision is really based on an individual's perception of their risk, or indeed their risk of putting their partners at risk, if that makes sense to you, right? I guess, but at clinics, usually it's based on episodes of condomless sex plus having STIs. But that criteria on the whole mainly has been used with gay men. But I think generally it would be very much based on your own perception of your risk, yeah? But I think, and because I'm not a PrEP expert, there is an organization called PrEPstar, who do a fantastic resource called for frequently asked questions. So if you, I can give you the details of the page, you know, after the interview, maybe you can share that with people.
Yeah.
But on that page, they have frequently asked questions, which, you know, questions that people would normally ask, like, what is PrEP? What should I do before starting PrEP? How should I stop and restart taking PrEP? Can PrEP be used by everyone? Is it safe or legal to buy it online? Can I take it with other medication? Where can I get it? Well, you know, side effects, just the key questions that people ask about PrEP, and then they can make the decision about what they need to do and how to access it. So I will give you the link to that page, which answers all those questions about PrEP.
That would be great. Thank you very much. So moving on to your work within HIV and pregnancy, what is a common myth you hear from people around HIV and pregnancy, and how do you address these myths?
There are
it's going to be a good one.
Another good question. I think there's myths, there's also misinformation, there's also judgment and stigma. So I think the first one I'm going to talk about, I'll talk about a few of them. The first one I'm going to talk about is, the belief out there, or the judgment and the stigma that people living with HIV shouldn't have babies, you know? I mean, that's just like, don't believe the hype, don't listen to them. You have every right, just like any other person without HIV, to have a child. Some of the myths or misinformation are about the fact that people may think that HIV might affect their pregnancy, or that pregnancy might affect their HIV. Some of them include the fact that people think that you cannot conceive naturally. But the reality is, having HIV alone need not be a barrier to getting pregnant or starting a family. Of course, if you have other underlying conditions, then that's a different thing altogether. But this myth or misconception about you cannot conceive naturally, yes, in the olden days when some of people like me had babies, my daughter is now 23 years old. In the olden days, the advice was quite different. We didn't have things that we have, like, PrEP, and we didn't have the concept of U equals U, which means undetectable is untransmittable. I don't know if you've heard about that. Yeah. What it basically means that when someone living with HIV takes their medication and they achieve what they call undetectable viral load, which basically means that the level of virus in your body is reduced so much so and under control that you cannot pass it on either to a sexual partner or to an unborn child. So that means that nowadays, people can conceive naturally if they have an undetectable viral load. So that's a big step. So that's another myth which we can shatter right now. The other misinformation is about some people who do not have the information think that, mothers or parents with HIV will always give birth to children with HIV, but that's not the reality. And even if a child is born with HIV, nowadays children born with HIV have as good a life expectancy as other children. Many children born with HIV are now moving on to their 30s and 40s. They're all also having relationships and having their own children who are actually being born without HIV. So that's where we are at the moment. And this is a myth that we need to shatter and to kind of give the right information about. Another one, I'm just going to talk one more.
That's fine.
And that's the one about, and this is to do also with the guidelines from the beginning. People believe that women living with HIV cannot breastfeed. And yes, that was the guidance before. We didn't have what we didn't know, what we knew now, the information that we have now and the intervention that we have now. And of course, in the UK, the advice and the guidance is still not to breastfeed. However, if women living with HIV choose to breastfeed, they can be supported to do so safely. And the reason why partly the advice is not to breastfeed, because we know that the risk between, if you breastfeed, if you do not breastfeed, if you formula feed, there is absolutely zero risk. However, we have to take into consideration the fact that there are other countries, of the countries that follow the World Health Organization guidelines, and women in those countries, as you will know, you probably know, do breastfeed their children. But of course, it's very much about ensuring that the women who are positive and pregnant and having children have medication, because as you reduce the viral load, it means you also reduce the risk of passing HIV onto a baby. So that's just another piece of information that is important to note.
Thank you
So
very much,
okay.
Angelina. I learned a lot of, from that one because I didn't know about the breastfeeding in the UK.
All right.
Lastly, from your own lived experience, what is one piece of advice to women living with HIV who are thinking about pregnancy or who are already pregnant?
One piece of advice. I can give one piece of advice in lots of little sections.
That would be great.
Okay, so the first piece of advice I would give is that you are not alone. I had my baby 5 years after my diagnosis, and she was born without HIV. She's now 23 years old and doing well as a singer-songwriter. So what I'm trying to say here is that there are many millions of us in the world living with HIV who are having babies. So you're not alone. There are many more who are diagnosed either during pregnancy or who have given birth after an HIV diagnosis. And with access to treatment, care, and support, you can have a very good pregnancy journey. What I'd also say is that having HIV alone may not be a barrier to having a baby. And as I mentioned before, unlike in my days when I had my advice was to take medication, have cesarean sections and not to breastfeed, but times and guidelines have changed. Having an undetectable viral load means you can have a baby vaginally and only have a cesarean section if it's an emergency. Then this is advice which is given to other women who do not have HIV. And you can be supported to breastfeed safely if that is what you choose. But it's about being very clear with your healthcare provider that this is my choice, but also you need to be able to engage with healthcare services, be able to go for regular monitoring, the baby needs to go for regular testing. It's a choice you have, but you need to speak to your healthcare team so that they can support you to do it safely. And one important thing to do is to access peer support, because you cannot put a value on the support you receive from someone who has walked in your shoes. And your healthcare provider can refer you or tell you about HIV support organizations that provide peer support in your area. And of course, you can always get in touch with us at the Forum Network of Mental Mothers Living with HIV.
Thank you so much, Angelina. Thank you for empowering women through your story and your excellent contributions in the world of HIV. We hope that with this interview, we can continue to empower the women in Barnet to take charge and the women also in England and worldwide. So thank you very much.
Thank you for having me, Belinda.